Hello, ladies and gentlemen. I'm Dr. Kelvin Burton, and I have been asked by your colleague, Hannah Luke, to speak to you today about Botox, or what is commonly known as botulinum toxin. First of all, I'd like to tell you a little bit about myself. I am a board-certified family practitioner in Douglasville, Georgia. I have a practice named Total Care Family Medicine, as well as another practice which is a cosmetic practice called Laser Body Works. These practices both engage in the use of Botox, and I am considered an expert in that field. So I'm very happy to talk to you about Botox. So let's talk about Botox. Botox, or botulinum toxin type A, is, first of all, when we hear the word toxin, we think of something negative. We think of something that's going to hurt us. We think of something that's harmful. And in some ways that can be true. But I'm here to let you know that Botox in the medical uses is really quite safe. Let me tell you why. Botox is measured for all medical purposes in units. And a lethal dose of Botox is about 3,000 units. For the uses that I have in the clinic and clinical uses, generally we use about 20 to 200 units of Botox. So as you can see, the clinical uses for this particular product are used at very safe levels. So what are some of the clinical uses for Botox? Well, before I get into that, I want to tell you that instead of the toxin part, since we've already established that it's safe, let me let you know that it's really a purified protein. You know, proteins, the building blocks for the meat that we eat, and so on and so forth. Maybe now you can see this as a little bit more of a safer thing, instead of referring to it always as a toxin. What are some of the uses then? Well, one of the things is you can use it to stop bladder spasms in the urinary bladder. I don't use it for that, but the urologist, who is a specialist in the bladder and kidneys and urine, would be one that you would go to for that type of procedure. Another procedure that we can use it for is for something called hyperhidrosis. Have you ever seen anybody who just sweats a whole lot under their arms?
Ew.
Have you seen that before? Well, Botox can actually help to stop that and to make that a less embarrassing scenario. Also, we can use it in the decrease of migraine headaches. Some people suffer from migraine headaches almost every single day, or somewhere thereabout. Botox can be used to relax the muscles, and in order for people who suffer from migraines to suffer from these at a much less frequency. My main use, I use it obviously for the hyperhidrosis or the excessive sweating under the arms. I also can use it for migraines, for those of you who suffer from migraines. But my main use is in the world of cosmetics. I love making you look beautiful. So, what about that particular cosmetic use? Generally, with Botox, because of its action on the nerve endings in the muscle, it relaxes muscle. So therefore, the things that we do with our face that causes muscle tension and expressions of our face, Botox has a tendency, or its use is to relax those muscles. For instance, when you frown like this, you can see that there's a lot of muscles that are used there. When you have a look of surprise, like this, again, there's wrinkling of the skin. And when you smile, some people get what's called crow's feet and wrinkling on the side of their face. Botox relaxes those muscles, which are called dynamic muscles, because they are the muscles of motion and of expression. What Botox basically does is relaxes those muscles and makes it so that you are not looking as if you're frowning. The looks of surprise and disgust go away, as well as when you smile, you still maintain a very nice look around the eye, in and around the eyes. and doesn't draw attention to you when you have a look of happiness. Basically, most people say that people who have gone through a Botox treatment on their face kind of look like they're always happy, which isn't that the way we want to look anyway? Therefore, let me show you how we administer Botox. There are two main producers of Botox in America. One of them is Allergan, and they are the ones that coined that name Botox. But there's also another form made by Merz called Xeomin. These two are the main ones, and this is what I use in my practice. Botox, we draw it up, like I said, into units. And this particular syringe tells me how many units, depending on how it's mixed. And guess what? Hannah knows how to do this. And so therefore, when we draw it up into the amount of units that we need. Then we take the Botox into the units that we need. And I use many different needles because as you poke the needles into the skin, they get more and more dull, and they have a tendency to become more and more painful. But if you're using a sharp needle in your technique and you are very gentle with your patient, it is really a very painless procedure. So what we would do is I would put an injection of so many units into the procerus area, procerus muscles, which are here, and also the corrugators, which cause frowning. I also put injections into the frontal muscles in certain areas, as well as the muscles, the orbicularis muscles around the eye. So that's primarily where we use Botox in the face, as well as for the cosmetic procedures. There are other places that we can use Botox in the face, but those are much more advanced and probably not of concern to you for this class purpose. I hope now that I have given you some more knowledge about Botox, botulinum toxin, a very safe, purified protein that has many medical uses and that can cause a great benefit to you and those around you. Thank you so much.